Today, we're taking a deep dive into an organ that honestly doesn't get a lot of glory, but is an absolute powerhouse, the pancreas. It works tirelessly behind the scenes for us every single day. So, what happens when this quiet workhorse runs into trouble? Let's get into it. So, let's start with the basics. You hear all about the heart and the brain, right? But the pancreas? It's kind of the unsung hero of your internal organs. Before we jump into the problems, we've got to understand why this little guy is so critical to your everyday life. All right, so your pancreas is juggling two massive jobs. First, think of it as a super efficient factory, pumping out powerful enzymes to break down all the food you eat. At the same time, it's your body's blood sugar manager, making hormones like insulin to keep everything in balance. It's a factory and a manager, all wrapped up in one. Okay, now let's talk about what happens when things go sideways. We'll start with something you could call a sudden fire inside the organ, acute pancreatitis. And I mean sudden. This isn't some slow brewing problem, it's a full-on, incredibly painful attack. The classic sign of this is just unmistakable. Picture a severe, intense pain right in the upper middle of your abdomen that feels like it's boring a hole straight through to your back. It's an agonizing kind of pain, and often the only thing that gives even a tiny bit of relief is curling up and bending forward. So, how do doctors nail the diagnosis? Well, the first clues come from blood tests. They're looking for sky-high levels of an enzyme called amylase and an ultrasound, but the real gold standard is a special kind of CT scan. And here's the key. Other issues, like an inflamed gallbladder, don't cause that same huge spike in amylase. That's how doctors know for sure that the pancreas is the one screaming for help. But not all pancreatic problems are a sudden explosion. If the acute version is a wildfire, then chronic pancreatitis is more like a slow, relentless burn. It's the kind of thing that causes gradual and unfortunately irreversible damage over a long period of time. Now, with this slow burn, the most common cause usually isn't gallstones like in acute attacks. It's often long-term alcohol consumption. On an X-ray, a big telltale sign is calcification. The pancreatic tissue literally starts to harden. And here's a surprising twist. Unlike the acute attack, blood amylase levels can be totally normal. This slow, simmering damage can also lead to really serious stuff, like a dangerous bulge in a major artery nearby. So let's just put these two side by side because the differences are so important. Acute, often caused by gallstones, hits you with sudden, severe pain, and your amylase goes through the roof. Chronic, typically linked to alcohol, brings on recurring pain and weight loss, and that calcification is the key clue. See, two very, very different ways this organ can be in trouble. So, what if there's a blockage causing all this chaos? How can doctors actually see inside and maybe even fix it? There's a really cool procedure called ERCP. It sounds super technical, but it's pretty logical when you break it down. They guide a tiny scope right to the pancreatic duct, inject a special dye that lights up all the pipework on an X-ray, and if they spot a blockage, they can often place a tiny tube, a stent, to open things right back up. But the story doesn't stop with just inflammation. Years and years of damage, especially from that slow burn of chronic pancreatitis, can set the stage for even more severe, life-threatening problems. We're talking about things like cancer and these strange fluid collections called pseudocysts. When we talk about what puts someone at risk for pancreatic cancer, two big things jump out. Smoking is a major one for sure, but look at this direct connection. Chronic pancreatitis itself, that long-term damage we've been talking about, is a huge risk factor for developing cancer. The vast majority of these cancers, about 85%, are a specific type called ductal adenocarcinoma, and more often than not, they show up in what's called the head of the pancreas. Now, this location is really important. Why? Because a tumor there can block the bile duct and cause jaundice, yellowing of the skin, which can act as an early warning sign. Tumors in the body or tail of the pancreas are sneakier. They're often silent, which means they get found much, much later. And that late detection is a huge reason why the outlook is so tough. Just let this sink in. Even in the best cases with the best treatment, the 5-year survival rate for pancreatic cancer is only around 30%. It's a really sobering number that just highlights how serious this disease is. Another potential consequence, especially after a bad bout of pancreatitis or a major injury to your abdomen, is something called a pancreatic pseudocyst. The clue is right there in the name. It's a pseudo, or false, cyst. And that's because this pocket of fluid isn't lined by a special layer of cells like a true cystus. That's the crucial difference to remember. So, after all that, what are the big takeaways? What does this all mean for you? Let's bring it all together and decode the key signals your body might be sending you so you can actually understand what they might mean. Okay, let's do a quick fire round. That sudden, brutal abdominal pain that goes to your back, classic acute pancreatitis. Recurring pain and you're losing weight without trying, that should make you think chronic pancreatitis. Your skin is turning yellow, that could be a tumor in the head of the pancreas. And if you start having weird issues a few weeks after a major abdominal injury, it could point to a pseudocyst. You know, when you boil it all down, it really comes to this. Your body is always communicating with you. Pain, weight loss, jaundice, those are all signals. They are your body's language. And understanding what those signals could mean is the absolute most important first step. So I'll just leave you with this to think about. After everything we've covered today, knowing how distinct these signs can be, what's the one signal from your body that you will absolutely never ignore again?